Principle 2. Thorough check and getting image of every part of the target organ are needed. Principle 3. There are two ways of taking pictures, descending order method, which means you start taking pictures when the scope is inserted, and ascending order method, taking picture with the scope withdrawal. Descending order method, pharynx, larynx, esophagus, stomach, duodenum. Ascending order method, duodenum, stomach, esophagus, pharynx, larynx. Principle 4. This protocol shows descending order method as a basic method. It's difficult to aspirate air in the stomach or the duodenum completely by ascending order method. The patients feel very uncomfortable if he or she can belch. When you see the image after the examination, it's easier to understand with descending order method. Notice 1. Examination and taking picture under right condition. Considering the color tone and the size of the lumen, adjust the lightness. Keep in mind that the automatic adjustment of the lightness by the light source is semi-automatic, but not full automatic. Notice 2. To take clear and sharp images, you need to keep the lens of the endoscope under the right condition. Solid lens cleaner is better than liquid one. Notice 3. Most of the time, one film, 20 to 21 images is enough. The number of the film varies according to the patient. Sometimes you need 2 or more films. 1. Pharynx, larynx. Take care not to miss the abnormal lesions in the pharynx, larynx. Images of pharynx, larynx. 1. Pharynx, larynx. 2. Esophagus. Check the extraluminal oppression by the vertebral, aortic arch, tracheal artery, trachea, or left principal bronchus. Images. 2. All side of the aortic arch. 3. All side of the tracheal bifurcation. 4. At the tracheal bifurcation. 5. Between the tracheal bifurcation and the SC junction. 6. All side of the SC junction. Three. Stomach 1. Regardless of the presence of the abnormal region, complete check of every part of the stomach is needed. Taking a picture with peristalsis is inappropriate. If you examine the esophagus properly, there must be enough air in the stomach. 3. Stomach 2. When the scope gets into the stomach, make the scope J-turn to U-turn and withdraw the liquid in the stomach. Wash out the mucus. Taking carotene, existence of hemorrhagic content or size of the lumen into the consideration. Adjust the scope settings, lightness, magnification, and so on. Images of a stomach 1. With the scope U-turn. 7. Pharynx, greater curve of the upper body. 8. Cardia, lesser curve of the upper body. Rotate the fiber 800 degrees, J-turn. 9. Lesser curve of the middle body. 10. Lesser curve of the lower body. Upper side of the angle. Images of the stomach 2. Looking down the stomach by the withdrawing endoscope. 13. Greater curve of the upper body. 14. Upper body. 15. Middle body. 16. Lower body. 17. Angle. Images of the stomach 3. Prepyloric region. 18. Distant view. Full view. 19. Close-up view. Full view. 20. Close-up view of the pylorus. (4) Duodenum. When you insert the fiber into the duodenum, take care not to make contact breathing. If you find a ridge formation, follow the ridge to the end. Make sure to check the lumen just behind the pharynx. Be aware the trouble tends to happen when you try to insert the scope into the second portion. Take care of a bulge and vomiting reflex. Images of duodenum. 21. Duodenal bulb and SDA. 22. Second portion. (5) Withdrawal. Withdraw the scope with aspirating air. Make sure not to miss the scurous change of the greater curve of the body. Observation of the esophagus, UT to CE, entrance of the esophagus. Don't miss the ectopic columnar epithelium.